fluid electrolyte balance problems. If you're following me in the course pack, you'll want to turn to page 124. So there's three things that we need to address when we look at these problems. We first need to identify which blood pressure is lost, blood hydrostatic pressure or blood osmotic pressure. The second thing we need to consider is if we're looking at a form of dehydration or a form of overhydration. And finally, the third thing we need to consider is in which direction will fluids move, from the capillary into the interstitial space and into the cell, or from the interstitial space back into the capillary and eventually also pull from the cell to the interstitial space back into the capillary. So let's tackle this first problem. You'll notice that we're talking about an infection resulting in edema. The clue here for us is that it's leading to a loss of blood protein, so that's really what I'm going to focus in on. We know that loss means dehydration. And we also know that blood proteins are associated with blood osmotic pressure, not blood hydrostatic pressure. In fact, we're looking at a loss of BOP, and we're also looking at a specific form of dehydration. Now, we need to figure out if this is hypertonic dehydration or hypotonic dehydration. And because we're looking at a loss of blood osmotic pressure, that falls into the category of hypotonic dehydration. Okay, so now here's what we need to figure out. If we're talking about a capillary, let's just simply draw a capillary here, and we're talking about decreased blood osmotic pressure. That will not influence the filtration so much because blood hydrostatic pressure is still normal. So we can still filter out normally at the arterial end of the capillary. But what we cannot do is reabsorb fluids at the venial end of the capillary. So that means we're still filtering out here down at the venial end of your capillary. Unfortunately, this puts excess fluid in the interstitial space, and that leads to edema. That answers our question. These hypotonic fluids flow from your capillary into the interstitial space, and from the interstitial space into our cells. So eventually the cells will bloat. So the fluid movement is like this. From the capillary to the interstitial space, that causes edema, and into the cells. And given enough time, those cells will bloat. So that's how an infection can lead to cells bloating and edema in the interstitial space. Let's talk about this next problem. The next problem says that drinking large amounts of seawater will affect the normal movement of the blood plasma and interstitial fluids back and forth. So our job is to figure out exactly how that is going to be changed. You'll notice here that seawater causes hypernatremia. Well, that's sodium, and that's an excess. Hyper means excess of sodium. So that means too much salt in the bloodstream, and that actually leads to an increase in which pressure? Blood osmotic or blood hydrostatic? That's blood osmotic pressure. But here's the real issue. We're going to look at this from the perspective of being a loss or a dehydration event. So we know that loss of fluids means that this is some form of dehydration. And because it's loss of fluids, we're talking about the loss of blood hydrostatic pressure. Now, since we know it's a loss of blood hydrostatic pressure, is this form of dehydration hypertonic or hypotonic? Well, we know that hydrostatic pressure is linked to hypertonic fluids, or hypertonic dehydration rather. So we're going to see this particular situation be a hypertonic dehydration issue. So let's map out our capillary one more time. So we're going to lose BHP. And you also might consider that we're going to increase BOP. If this is the case, are you able to filter at the arterial end of your capillary? You'll have a hard time doing it. So let's say that we're not able to filter here. And at our venial end of the capillary, we've got decreased BHP, and we have increased salt in the bloodstream, so we've got increased BOP. So instead of being able to filter, we're only able to reabsorb. So which fluid compartment is pulled from first? We pull fluids first from the interstitial space back into the capillary, and then as the interstitial space becomes hypertonic, we then can pull fluids out of our cells. So the fluids will move from the cells to the interstitial space and then back into that capillary. So just to keep track of fluid movements here, we come from the cells to the interstitial space, back to the blood plasma, and of course that blood is filtered by the kidneys and removed in the urine. So in this situation, cells will shrivel and we will lose our fluids, becoming further dehydrated if we drink large amounts of seawater. You know, drinking seawater is bad news because ultimately it will lead to death, and before you get there, it causes kidneys to shut down because they can't process this concentrated fluid, and of course it can also cause things like hallucinations. So bad news, don't drink the seawater, it can kill you. Let's talk about extensive diarrhea. This is not a one-off instance of diarrhea. This is an extensive case where we tend to see loss of solutes and proteins from the bloodstream. Because this says loss, we are looking at a dehydration event. And solutes and proteins give me a clue. Which pressure is being decreased here? Is it hydrostatic pressure that's dependent upon solutes and proteins, or is it osmotic pressure? It's osmotic pressure. All right, so which particular form of dehydration deals with a loss of BOP? Is it hypotonic or hypertonic dehydration? We know that BOP losses are linked to hypotonic dehydration. So let's take a moment to look at our capillary once again. If we have normal BHP, but a loss of BOP, we can still filter at the arterial end of the capillary. Once you reach the venial end of the capillary, if BHP continues to drop like normal, but we have a much decreased BOP, BOP is normally the one that helps us to reabsorb. So we're not able to reabsorb down here. Instead, we're only capable of continuing to filter. So that means that fluids are pushed out into the interstitial space first, and from there, if the fluids are hypotonic, which they will be, that fluid will then travel on into the cells. Now, what happens to cells that receive excess fluid? Those cells will bloat. All right, so ultimately, extensive diarrhea can cause swelling in your cells and edema in the interstitial space. Not something you normally think of when you're talking about dehydration during diarrhea. But in fact, we can see the cells and the interstitial spaces swell. So here's how fluids move. They move from the blood plasma in the capillary to the interstitial space, causing edema. And from the interstitial space, those fluids are hypotonic and can move into the cells, causing them to bloat. So just put a little note here, edema and bloating can result from these extensive setups of diarrhea. Let's talk about this problem here. Before we even talk about the problem, let's talk about blood for just a moment. I'm going to use this space up here to talk about blood. On average, a person has about 5 liters of blood. Around 55% of that is fluid. And what is that fluid called? That fluid is called blood plasma. The other 45% on average are formed elements, and almost all of those are red blood cells because we have such small populations of white blood cells and platelets. So when you're talking about fluids or plasma in blood, we know that proteins are a portion of the blood. Okay, so when you're talking about fluid loss, like blood loss, we have to keep in mind that proteins are a portion of the blood plasma, which contributes about roughly half of blood's volume. Now, when you're thinking about total fluids in the body, most of our fluids are stored inside cells as intracellular fluid. That accounts for around 25 liters. We have about 40 total liters of blood or fluids in the body. So when you're talking about losing a portion of your blood, you're not losing all of the fluids in your body. You're losing a portion of those fluids. So just something to keep in mind. Now, when we talk about loss of blood proteins, loss means dehydration. And blood proteins means we're dealing with which pressure in the blood, hydrostatic or osmotic. This is loss of osmotic pressure. Since we're talking about osmotic pressure, are we talking about hypotonic dehydration or hypertonic? This is hypotonic dehydration. So let's take a look at our capillary. Down here's our arterial end, and down here's our venular end. If blood hydrostatic pressure is normal, but BOP has decreased, can we still filter at the arterial end? And the answer is yes. Okay, because that's primarily dependent upon blood hydrostatic pressure. At the venular end of your capillary, we still have decreased blood osmotic pressure, and that's the one that helps to reabsorb fluids back into the capillary. So we're unable to reabsorb, and so since that's not going to happen, we still see fluids flow out into the interstitial space first, causing edema, and then into the cells, and that of course causes cells to bloat. So let's just keep track of how fluids move. The fluids move from the blood plasma into the interstitial space, causing edema, and into the cells. They too can bloat. So how do you fix this kind of problem? Make sure that this person gets fluids with blood proteins to help move the fluids back into the capillary. That should reduce the swelling and edema in the interstitial space. All right, let's take a look at our fifth question on page 124. This time we're talking about a lymphatic obstruction in the axillary area of the left arm. Just a reminder, you know that the lymphatic system helps to transport extra fluids in the interstitial space back to the heart. So if there's an obstruction in that lymphatic vessel, then we may not be able to return the fluids and the blood proteins lost to the interstitial space back to the heart. So not only do lymphatic vessels pick up escaped fluids, they will also pick up proteins that escape the bloodstream. So this is critical that we get these blood proteins back into the bloodstream because they contribute to blood osmotic pressure. So I think you're probably starting to see the pattern here. Loss means dehydration, not overhydration. And if we're losing blood proteins, that leads to a decrease of blood osmotic pressure. We know that blood osmotic pressure and protein loss is linked to hypotonic dehydration. In the situation of hypotonic dehydration, let's look at our capillary. Here's our arterial end, down here's our venular end. If we have normal blood hydrostatic pressure, but a loss of blood osmotic pressure, that's the primarily influenced pressure, we can still filter at the arterial end of the capillary. But what happens to those pressures down here? Well, unfortunately, a loss of BOP means that we cannot do reabsorption. And so that means that blood is still, or fluids are still flowing out from the bloodstream into your interstitial space, causing edema, and into the cell, causing it to bloat. So just to keep track of fluid movements here in this situation, it's from the blood plasma into the interstitial space, causing edema, and into the cell. Those cells will then bloat. All right, so just thinking about this whole big picture, when we talk about what's primarily lost, that's how we figure out what kind of dehydration we've got. So even though you may not get fluids back into the bloodstream, it is the loss of proteins that cause the biggest change in the way these fluids flow. So it is very easy to get caught into the whole conversation or thoughts about, yeah, we're losing fluids too, but it's the loss of blood proteins from the bloodstream that can't get back into the blood that cause this issue. Let's talk about this problem. We're talking about diabetes mellitus, which causes a loss of fluids in the bloodstream. So two things to look at here. Loss means some form of dehydration, And fluids indicate what we're losing. We're primarily losing blood hydrostatic pressure because that pressure is based on fluids in the bloodstream. Now we know that hypertonic dehydration is based on fluid loss. So let's take a look at our capillary for just a moment. So here we're losing blood hydrostatic pressure and blood osmotic pressure is normal. We require high blood hydrostatic pressure to force fluids out of a capillary. So if we have lost blood hydrostatic pressure, we may not be able to filter as effectively in our capillary. Instead, we may be only able to reabsorb fluids back into the capillary. Likewise, normally at the venial end of our capillary, we expect to see reabsorption, but this increased reabsorption may be due to the lack of blood hydrostatic pressure. Get my tongue tied there. All right, so we're going to pull fluids from the interstitial fluid back into the plasma first, and then we're going to pull fluids from the cells to the interstitial fluid back into the blood plasma. So what do you think happens to cells when they're placed in these hypertonic solutions? Those cells will shrivel. So let's keep track of our fluid movement here. We're talking about fluids moving from interstitial fluid into the plasma and then getting pulled from the cell into the interstitial space back into the blood plasma. Let's just keep a note here that cells will shrivel in this situation because we see the fluids being pulled toward the hypertonic interstitial fluid and then back into the blood plasma. Well, let's think big picture. These fluids travel to the kidney. The kidney says, hey, look, we've got all this excess fluid. It gets filtered, does not get reabsorbed in the kidney. So where does this excess fluid end up? It ends up in your urine. So ultimately, this particular situation leads to a loss of fluids in the urine. And all of this has to do with the basis for diabetes mellitus and, in fact, diabetes insipidus. Let's talk about this condition, hyponatremia. It is a loss of blood sodium. So loss tells me what? Overhydration or dehydration? Dehydration. Blood sodium tells me we're dealing with a particular type of pressure in the blood, and it is blood osmotic pressure. So we lose blood osmotic pressure. Now that I know we're losing solutes and proteins, I know that this is a form of hypotonic dehydration. So in this case, without drawing the picture, can you tell me what happens to fluid movement? Fluids move from the plasma into the interstitial space, causing edema. And from this interstitial space, fluid flows into cells and they will bloat. Okay, so if you have low sodium, perhaps due to low aldosterone levels, for instance, then we may see this situation where cells bloat due to fluids moving out of the capillary and not being able to reabsorb back in. All right, so let's talk about question 8. High blood pressure, such as 175/110, creates an imbalance. There's more fluid in the bloodstream and less sodium. There's two ways to think about this. So let's tackle low sodium first. What pressure is decreased when you don't have enough sodium? It's blood osmotic pressure. So remember our seesaw, sodium and water ride a seesaw. And if you end up decreasing the sodium, you end up increasing the water. So what we end up doing is actually giving ourselves too much fluid for the water or for the sodium that we have to balance it. Let's tackle this one from a loss. If you don't have enough sodium to balance the water that you've got, then which particular form of dehydration do we have? This would be hypotonic dehydration. So how do we figure that out? It's because we have too little of something, and we have too little sodium ions compared to the water that's in the bloodstream. Remember, this blood pressure here is based on water, and so there's too much water for the salt that you have. let's talk about our capillary and the fluid movements. If you've lost BOP, but you have high blood pressure, right, because you've got high blood hydrostatic pressure, high blood pressure is the same thing as high blood hydrostatic pressure, okay? So are you filtering or reabsorbing at this arterial end of your capillary? You're filtering like crazy, right? So fluids are being pushed out. If you still have fairly high blood hydrostatic pressure at the venial end and low blood osmotic pressure, you're unable to reabsorb, so you're still filtering. Okay, so help me out here. Where do fluids travel first? First, the fluids travel into the interstitial space. That causes edema, and then those fluids travel into our cells, and of course that can lead to a case of cell swelling. So like we expect with blood pressure, we tend to see swollen tissues, that's edema, and bloated cells. So the case is not necessarily to eat more sodium. The case here is the person should decrease the amount of fluids they take. That's why diuretics and blood pressure medications often function to lower the amount of fluids in the bloodstream. So diuretics will flush out the fluids, putting the balance of salt and water, like we talked earlier, back more into perspective. Question 9, let's talk about hypertonic drips of fluids. And even though you're receiving fluid, the issue here is you've got a loss of fluids in relationship to the blood sodium levels. So remember, sodium and water, they are on a seesaw. So if you lose water, then that means you in effect increase the sodium. So that tips this seesaw in this direction. So if we're losing fluids, which pressure are we losing? Blood hydrostatic pressure. And since we're dealing with a loss, we're dealing with a form of dehydration. We're going to call this one hypertonic dehydration. So let's talk about our capillary. And if we're losing blood hydrostatic pressure, but blood osmotic pressure is normal here, maybe we're not really able to filter. Maybe instead we're reabsorbing fluids from the interstitial space. Likewise, at the venial end of your capillary, if blood osmotic pressure is the dominant or higher pressure, then we're still reabsorbing fluids back into the capillary. So since we're able to reabsorb, but not able to filter, we pull fluids first from the interstitial space, and then, since those fluids are hypertonic, we pull fluid out of those cells. So let's keep track of the fluid movements. The fluid movements travel from the cells to the interstitial space to the blood plasma, and those cells will shrivel. Oh, I cannot spell today. Let's erase that and start over. Okay, and so those cells will get smaller as we have them immersed in a hypertonic fluid. So that's the goal of a hypertonic drip, is to pull fluids off the cells and tissues. A person who has, say, heart failure may experience swelling of the cells and tissues, and this is how you bring those fluids into the bloodstream. Once the fluids reach the bloodstream, they can be filtered and excreted by the kidneys in the urine. All right, the last problem here is called glomerular nephritis, and the clue is loss of blood proteins. So when the kidney nephrons become inflamed, normally those nephrons have a loop of capillaries called the glomerulus, and this is the Bowman's capsule here that surrounds that glomerulus. Now, if this glomerulus, this set of capillaries in here, becomes inflamed, then the membrane becomes more porous, allowing big blood proteins to escape and to be lost down into this renal tubule system. Unfortunately, there is no way to reclaim those proteins if they're filtered. We have no mechanism in place to reabsorb lost blood proteins. So they are destined for becoming part of the urine that is excreted from the body. So here's our clue. We're losing something, and it is blood proteins. Well, blood proteins are linked to a decrease in blood osmotic pressure if we're losing them, and that tells me that we have hypotonic dehydration. So let's take a look at our capillary. So if we have normal blood hydrostatic pressure, but we have lost blood osmotic pressure, then filtration can still occur in this capillary. The problem arises when we normally reabsorb those fluids at the venule end. Since we're not able to reabsorb, no reabsorption can occur, then we're still filtering those fluids out into the interstitial space. So fluids fill the interstitial space, we expect to see edema, and then because these are hypotonic fluids, those fluids will travel next into our cells, and guess what happens? They bloat. Okay, so just keeping track of the fluid movement here. The fluid moves from the blood plasma into the interstitial space first, causing edema, and from there into our cells, they will bloat. Well, I hope this has helped and that you've got the hang of these fluid electrolyte balance problems. I will always give you what we're losing or gaining. Actually, none of these problems here were hydration problems. They were all dehydration problems. But look out for my clues. I'll give them in parentheses. We're either losing blood proteins, blood solutes like sodium, or we're losing water from the bloodstream. And that should help you figure out what type of pressure is lost and what form of dehydration we're dealing with. Now, I would encourage you, if you need some extra practice, to try page 125. The answers are at the bottom of that page for you.